Good day everyone, I am Josel I. Carbonell, student nurse from Nueva Ecija University of Science and Technology. So for this video, I will be administering the intramuscular injection.
But what is the intramuscular injection? It's a method used to administer medication into the deep muscle tissue. Medication will be absorbed quickly due to the rich supply blood vessel in the muscle.
And for the assessment, review physicians or qualified practitioners' orders so that the drug is administered safely and correctly. Then, review information regarding the expected reaction to the allergen in order to anticipate the type of reaction a client may have. Then, assess for the indication for intradermal injection, including the client allergy history, so the nurse will know if the client has a sensitivity. Next, check the expiration date of medication of vial. Then, assess client knowledge regarding the medication to be received. And lastly, assess the client response to discussion about injections, since some client may express anticipatory anxiety which may increase
For
pain.
the planning, the client will experience only minimal pain or burning at the injection site. Then, the client will experience no allergic reactions or other side effects from the injection. And lastly, the client will be able to explain the action, side effect, dosage, and schedule of the medication.
Good day, ma'am. I am Josel I. Carbonell. I will be your student nurse for today. But before that, before we start the procedure, may I confirm your name, age, and birthday?
Samantha Vera, 19 years old, September 6, 2001.
So, nice to meet you, Miss Samantha. Today, I've been asked to give you an injection. But before that, are you allergic to anything? And do you have any bleeding disorder or do you take any blood medication? So, I'll prepare my equipment.
So the equipment needed: the Bersolin syringe, needle, antiseptic or alcohol swabs, sterile water, disposal gloves, tape, basin. So first, we need to perform hand hygiene to reduce the transmission of microorganisms. After that, put on gloves. So after wearing the gloves, I need to disinfect my sterile water and medication at the tip of my solute, so cotton with alcohol. Then open the syringe and aspirate. After that, we need to change the needle. Inspect skin for bruise or inflammation, edema, masses, tenders, and site of previous injection. Use anatomic landmarks. Use antiseptic swab to clean skin at site. Circular motion and mechanical action of swab remove secretion containing microorganisms. While holding the swab between finger of non-dominant hand, pull cap from needle. Swab remains accessible during procedure. Prevent contamination of needle. Then, hold syringe between thumb and forefinger of dominant hand like a dart. Spread skin tightly or pinch a generous section of tissue firmly. Inject needle quickly and firmly at 90-degree angle. Then, grasp the lower end of the syringe with non-dominant hand and position dominant hand to the end of the flanger. Do not move the syringe. And pull back on the plunger to ascertain if needle is in vein. If no blood appears, slowly inject the medication. Quickly withdraw the needle while applying pressure with the antiseptic swab. Supporting tissue around injection site minimize discomfort. Then, gently massage the site. Simultaneously circulation, improve drug distribution and absorption. And lastly, assist the client to comfortable position. Discards the uncapped needle and syringe in safe receptacle. Decrease risk of needle stick. Then, remove gloves and perform hand hygiene. Because it reduces transmission of microorganisms.
So, thank you, Miss Samantha. For the next few days, you might expect the arm to be slightly painful, and that's normal. Do keep an eye out for any sign of infection. If you're worried about bleeding or pain, come back and see us or seek medical advice. So, for the documentation, name of medication, check. Dosage, check. Route of administration, check. Location of injection, check. Time administered, check. Initial and signature for nurse administering medication, check. That's all for today, Miss Samantha. Thank you.